Hi guys, so today's video is given upon request. I've had a few patients who are at the moment stuck at home and who I've given exercise programs to follow at the gym, and that is strength-based exercise program, and they've been doing exercises based on gym machines, and I'm sure they haven't been the only ones, and I'm sure a lot of you have been. These machines, not everyone has them at home, but to stop you from feeling really confused what to do at home, but to keep you going in your rehab progress, I'm going to show you a few exercises that I give for patients with different conditions of knee problems, but they're basically strength training to different muscles of your legs. And this is to replace, for example, if you've been going to the gym and you've been using the leg press or the leg extensor for your quads, or the bent knee machine, or for your hip extensors, just a few things that you can do and push yourself to fatigue almost, to get your muscles really conditioned in a way that you don't lose all the effort that you've done over the past couple of weeks. Now, our programs are always based on after assessing our patients. So if you've never had yourself even just a discussion, it's important to speak to a physiotherapist before you attempt to do any of these things. We follow a protocol of trying to push the muscles to fatigue. So we don't do 3 sets of 10, we don't do 3 sets of 12. We just follow a protocol which is based on current research, and it's mainly to try and push the muscle to that fatigue state and progressing through about 12 weeks. This obviously has been through exposure of research and has been through exposure of giving a shout out to our colleague Claire Minchell, who has a very good strengthening conditioning program for physiotherapists if anyone is interested. So we have based our exercise conditioning programs following attending her course as well. So it's been working really well, and our patients have seen great results. And these exercises are being done by patients who have chronic OA, who have done a total hip or a total knee replacement, patients who have been in pain and after just starting these exercises have improved a lot. But obviously this is after consulting us. So if you've never done these exercises, I would always suggest you at least have a virtual assessment with us at the moment, because you obviously can't come into the clinic, but we're happy to do that, and there's always information. So please just follow the email address or the telephone number. Just give us a call and we're happy to set up a FaceTime or a call assessment to just speak to you before you start anything. But without chatting further on, I'm just going to show you what I do. So we're going to go through just some basic exercises. So the first one that a lot of people have asked is like the knee extensor machine. So you can do it in sitting. So if you have a higher chair, it's better. You need a few pieces of equipment, and these few pieces of equipment, they're nothing big. A backpack, which I always ask people to have. You can put anything in the backpack. If you have weights, that's great. If you have the very now famous laundry detergent bottle, it's very good to use because you can fill it with water, and as you progress into your strength, you can make it even harder. You can have a bag with, so like with handles, it's all going to depend on the length of the handles, because you'll see it makes a difference. You can have a full bottle of water in it, you can put potatoes, you can put vegetables, you can do whatever you want in it to make it hard. The whole concept is that you put enough weight in it that when you get to, for example, we start off with like an 8 repetition maximum. So that means that when you do your 8th rep, you absolutely cannot do a 9th repetition because you are tired and exhausted. So that's what we start off with. This progresses on a course of 12 weeks and it changes. So that is always why it's important to speak to us rather than just jump into it. So this is exactly just to get the patients going whilst they're at home. So I'm going to start off with the knee extensor. So normally the knee extensor is just sitting down and you extend your leg. Obviously you have no weights. So I found it really useful to have a breakfast chair rather than a normal chair. So get a breakfast chair. So again, you can either use a backpack. It depends on your feet, on your feet and how you are flexible onto your foot. Or you can use a handle. Remember, always be safe when you do these. So my shoes have been cleaned because we are inside. You sit onto the chair, make sure you're nice and comfortable. So if you're using a backpack, it's already filled with weight. You put your foot through the handle. Sometimes it's uncomfortable. So you can see, because it's big, it might not be very useful. So if it's smaller, it's better. So I have a smaller one here. You again do the same thing, you just need to adapt for your weight, and you're sitting through and you just extend the leg and then go back down. So this is good to get your quadriceps muscle going. Now if your bag is bigger or your handles are longer, the problem is you don't go through the full range with the weight. So this is an open handle bag, so if I bend my knee, up until this point there is no resistance, so that bit has no resistance. Then the end range you will get some strength. So the shorter the handles are and the smaller the bag is, it's just going to limit you to how much weight you can do. But that is knee extension. Now for knee flexion, which is basically your hamstrings going backwards like this, again you can have a small bag to do the same. This is going to be a problem putting it in though. So either having a bag like so, and again the problem is going to be starting at the bottom, you're not going to get any resistance, so it's only halfway, and then almost when you reach your end range is when you're going to get a bit of resistance. So my suggestion with this is you can keep the same bag, lie on the bed, face down, and do a bent knee. So this will be at the edge of the bed. So I can't show you at the moment, but that is easier to do with your face down on the bed and you're bending the knee backwards. So that's knee flexion and knee extension. The rest of them is a little bit more easier and less faff. So if you put your backpack with the weights, you can put it behind you to start off with. So I'm just going to move this back. So you're going to do squats, you can do it with the backpack behind you. Again, sitting back and lifting back up. Really making sure that you are squeezing through your legs. So this is your squats with weights. You can keep the backpack as is, and you can do heel raises to get your calf going. You can also do lunges, which is going down and then coming back up. Again, you have weight on the back, so it's giving you resistance. Again, switching, and you can do lunges onto the other leg. You can do wider squats, so your feet are wider rather than parallel. So you've got wide squats, and you go down, almost like a goblet squat, and then you can change it around if you don't feel comfortable. The focus is going to be slightly different. So you can hold the backpack, and you can do the backpack on the front. If you don't have a backpack, just grab a set of books or something heavy that you feel like you can push and hold it into your hands. And again, you're doing wide squats. You can do parallel squats, and you can do lunges, and you can do heel raises. Very good. Right, so you've done all those, so those are pretty much most of your legs. The other two things that are a little bit more faffing about is to replicate a leg press. So the leg press is when you put your leg against the machine and you're pushing yourself away. The only way I could replicate that at home is by using a towel. Ideally you have so I'm going to do it against here. Don't have much space, but ideally you can use a wall. So I'm going to do it on both sides actually. So again, you grab your weight or your backpack. I'm just going to remove my shoes for this. Lie onto the towel. You actually need to see me better. this is the faffing about, which is you need to lie on the floor, make sure you're as close as you can. It depends the angle of your knee. Hold the weight onto your chest or your tummy, and you want to either start low or you can start in neutral, so however you want, and you push yourself, and then you're going to have to come up and then push yourself closer and then push back. This is the only faffing about that you need to do for your leg press. With any other movement, so for example, if you're used to doing leg abduction or adduction for your side of your hip or even backwards, you can try having a bag with a long hoop, put it onto this sliding towel, place your hoop into the bag. So within the bag you can put anything you want. You can even put it directly onto the towel actually, and you're pushing away and pulling in. So when you push away and pull in, so just going to move my leg so you can see. You push away and then pull in. When you're pushing away, you're using the side of your leg, which is this side, and then when you're pulling in, you're using your adductors. So I turn it around. So again, I'm just going to move this way. The weight is on the towel, over onto the bag, and you hold on to something, and you're going to push away, and then you pull in. So you're pushing away against the weight, you're pulling in against the weight, and you're doing abduction and adduction, which is pushing out for your hip and pulling in for your hip. You can repeat the same thing for the back of your legs, which is hip extension. And you push back, and then you pull in. You push back, and then you pull in. So what's happening in this position is that you are also working your hip flexors. So that could be another option for doing hip extension and hip flexion. And the last one, I would say, just to give you a little bit more for strength training again, is a weighted bridge. So weighted bridge, sometimes I say people to put weight onto their hips. Again, you can use your backpack for this, and you lie onto the floor, knees bent, and you lift your hips and you lower down. You lift your hips and you lower down. And again, same thing in your backpack. You're going to start off with some stuff in it, which can be anything you have in the house that starts off to be easy but enough for you to do 8 repetitions, but getting exhausted at 8 that you can't do more than 8. 8 is a number we can start off with as a high number, but obviously it doesn't need to be 8. Sometimes people after a total knee replacement can start a bit higher, but it's that idea to get to the element of fatigue. As I said, this program goes on for a while, so if you have started it, especially if you were our patients, you know that we keep telling you that you have to keep going at least for 12 weeks, because in the beginning you'll get change and you'll start feeling stronger, but those changes are neurally, we call them, so they're not actual changes within the muscle themselves. So it's a lot of chat that we do when we have our sessions, and that's why it's important to speak to us if you have any issues and you're intending to want to take this opportunity whilst you're at home and try and increase your strength, whatever condition you have. Use these sessions that we are offering virtually. And you can chat to us and we can give you guidance, and we can also send you home exercise programs that will tell you exactly how to follow each week. And if any of you are therapists and you'd really want to go into any strength training programs that you want to get a little bit more knowledge, we're always rooting for our friend and colleague Claire Minchin, who has a course online called Strength and Conditioning for Therapists. It is great, we've all done it, and we use it quite a lot. So any questions after this, I hope they have been useful. Claire, if you have any other home exercises that you can also share with us, we'd also be very happy to share with everyone else. So if you have any questions, as always, let us know. Thank you.